Fatigue, belly fat, low drive, brain fog. Most men accept these as aging, but for millions, the real cause is low testosterone, and it's completely treatable. I'm Dr. James Whitaker, a board-certified urologist, and the topic of this video is one that I believe affects a far larger percentage of men than current statistics suggest, because it is chronically underdiagnosed, misattributed to other causes, and dismissed by both patients and sometimes physicians as an inevitable consequence of aging. I'm talking about low testosterone, and I'm here to tell you that the symptoms are real, they are measurable, and in most cases, they are entirely addressable. Let me begin with something fundamental. Testosterone is not just a sex hormone. I want to dismantle that misconception immediately, because when men think of testosterone, they think of libido and sexual function, and while those are absolutely affected by testosterone, the hormone does far more in the male body than that. Testosterone regulates muscle protein synthesis, the process by which your muscles repair and grow after exercise. It regulates bone mineral density, the strength and integrity of your skeletal system. It governs red blood cell production through stimulating the kidney's production of erythropoietin. It influences fat distribution and metabolic rate. It affects the production of neurotransmitters, including dopamine and serotonin, the brain chemicals that regulate mood, motivation, and cognitive function. It regulates sleep quality and sleep architecture. And yes, it governs libido and erectile function. When testosterone declines, and after age 40 it declines at approximately 1 to 2% per year in most men, the effects are systemic. They are felt in every one of those systems. And because the decline is gradual, men adapt to each new baseline without recognizing how far they've drifted from how they felt at their peak. Here are the 10 signs I look for when evaluating a patient for possible testosterone deficiency. Take note of how many of these resonate with you. Sign number 1 is persistent fatigue that sleep does not resolve. Not the tiredness that comes after a hard day's work and dissipates with a good night's sleep. The fatigue I'm describing is present even after adequate sleep. Men describe it as a heaviness, a lack of energy that follows them throughout the day regardless of how much they rest. This is because testosterone directly influences mitochondrial function, the energy production at the cellular level. When testosterone is low, cells are less efficient at producing energy. Sign number 2 is a significant sustained reduction in libido. Not a passing lack of interest, but a noticeable drop in sexual desire that persists over months. Men often describe this as simply not thinking about sex anymore, which for men who previously had a healthy sex drive represents a meaningful change from their baseline. Sign number 3 is erectile dysfunction, either difficulty achieving or difficulty maintaining erections. Testosterone is one of several factors involved in erectile function, and when it is significantly low, erectile function suffers. It's worth noting that ED can also result from purely vascular or psychological causes, which is why proper evaluation by a urologist is essential to identify the specific contributing factors in each patient. Sign number 4 is loss of muscle mass, particularly when combined with maintained or increased exercise effort. If you're working out regularly and watching your muscle tone disappear, or finding that you can't recover from exercise the way you used to, testosterone is almost certainly a contributing factor. Testosterone is the primary driver of muscle protein synthesis in men, and without adequate levels, you simply cannot build or maintain muscle efficiently, regardless of your training. Please do something important right now. Subscribe to this channel and hit the like button. I'm Dr. James Whitaker, and I post this kind of detailed medical content every single week. If this video is helping you understand something about your health that you didn't understand before, that's exactly why I make these videos. Share it with a man you know who might be experiencing these symptoms in silence, and leave a comment. I want to know, how many of these 10 signs are you personally experiencing right now? Sign number 5 is increasing body fat, particularly around the abdomen, despite no significant change in diet. This is one of the most frustrating symptoms for my patients, because they're eating the same as they always have. They may be exercising, and yet fat accumulates, particularly around the belly. Low testosterone impairs fat metabolism and promotes visceral fat accumulation. And here's the vicious cycle. Visceral fat contains an enzyme called aromatase that converts testosterone to estrogen. More belly fat means more conversion of your already low testosterone into estrogen, which promotes more belly fat. This cycle compounds over time unless the underlying hormonal issue is addressed. Sign number 6 is persistent mood changes, specifically irritability, anxiety, and depression. This is one of the most commonly missed presentations of low testosterone, and it is one that causes enormous damage to relationships and quality of life. Many men with low testosterone are being treated for depression with antidepressants, when the underlying issue is hormonal. Testosterone has direct effects on serotonin and dopamine receptor activity. Normalizing testosterone levels frequently resolves or significantly improves depressive symptoms in men who have not responded well to antidepressant therapy alone. Sign number 7 is cognitive changes, difficulty concentrating, memory lapses, mental slowness. Men describe feeling like their mind is not as sharp as it used to be. They lose words in conversation. They struggle to focus on tasks they used to perform effortlessly. Testosterone receptors exist throughout the brain, and testosterone has documented neuroprotective properties. Some research suggests that maintaining optimal testosterone levels in aging men is protective against cognitive decline. Sign number 8 is reduced bone density. This is perhaps the most underappreciated consequence of chronic low testosterone. Your bones are continuously being broken down and rebuilt, a process called remodeling. Testosterone is essential for stimulating bone formation. Men with long-term low testosterone have significantly higher rates of osteoporosis and fractures. Sign number 9 is disrupted sleep, difficulty falling asleep, staying asleep, or achieving deep restorative sleep stages. Testosterone levels naturally peak during REM sleep, and poor sleep suppresses testosterone production the following day. This creates another cycle. Low testosterone impairs sleep quality, and poor sleep further reduces testosterone production. Sign number 10 is physical changes, including reduced facial and body hair and smaller testicular volume. These are manifestations of chronic significant testosterone deficiency and typically appear after years of low levels. If you recognized yourself in 4 or more of these signs, here is exactly what to do. First, ask your doctor for a complete testosterone panel. This is a blood test, typically done in the morning between 7 and 10 a.m. when testosterone is at its daily peak. Request both total testosterone and free testosterone, because a significant percentage of testosterone circulates bound to proteins and is biologically inactive. Only free testosterone is available for use by your tissues. Second, implement the lifestyle interventions that have the strongest evidence for naturally supporting testosterone levels. Resistance exercise, weight training, is the single most potent natural testosterone stimulant available. Manage chronic stress. Elevated cortisol directly suppresses testosterone. Maintain a healthy body weight. Eat adequate dietary fat. Testosterone is synthesized from cholesterol, and very low-fat diets can impair hormone production. Third, if lifestyle optimization doesn't resolve your symptoms and your blood tests confirm low testosterone, discuss testosterone replacement therapy with a qualified physician. Modern TRT options include injections, gels, patches, and pellets, all of which are safe and effective when properly administered and monitored. The goal is not to achieve the testosterone of a 25-year-old. The goal is to restore you to the optimal range for your age and biology. I'm Dr. James Whitaker. Please don't accept fatigue, low mood, and declining function as inevitable aging. Get tested, get answers, take action. Subscribe to this channel, and I'll see you in the next video.